I'm Peter Dwyer with the Frederick Dental Clinic. I'm the principal dentist here. Right, root canal. Everyone dreads that term. Once you mention it, people freeze. Look, these days modern techniques are such that root canals can be just so easy. It's just like a long filling appointment. And what is the treatment? What is it used to treat? Root canals are normally done on back teeth or posterior teeth when a cavity has gotten too deep, bacteria has gotten onto the nerve of the tooth, the nerve has become inflamed or it has died, and a person wants to still hold onto that tooth. When that is the case, we need to very carefully, under very strong anaesthetic and something called a rubber dam to protect you, we very carefully take out the inflamed or infected nerve material. You don't feel any of it. We determine how many canals are in the tooth. In premolar teeth, it'll be between 1 and 2. Sometimes can be 3 and 4. In lower molars, you'll normally have 3 roots. In upper molars, predominantly it's 4. It takes a good while to do correctly and carefully. We use electronic equipment to determine the length of each root very, very accurately within 0.5 of a millimetre. We use specialised equipment to clean the canals, and then we carefully fill them with a material called gutta perca. Once this is done, a tooth at the back will almost always require what's called a crown or a cap, because once the root canal is carried out in a back tooth, it becomes brittle and normally it can be fragile. If you don't do a crown on it, you do run the risk of maybe the tooth cracking or the root cracking and having to have that tooth extracted. So when you're having a root canal at the back of the mouth, always be aware that a crown is going to be in need probably within 6 to 12 months. We're happy to do simple and complex root canal procedures at the clinic. So if you're in need of one, we're more than happy to see you. If it's an extremely complex one, we have a number of very, very nice specialists or endodontists that we can refer to. How long does a root canal take? Very much varies. A single rooted tooth, maybe about an hour. 2 roots, an hour and a half. 3 roots, 2 to 2.5 hours. Do they hurt, root canals? They should never hurt if proper anaesthetic is used. You certainly can drive after a root canal because it's just local anaesthetic, exactly the same as having a filling. And how long between root canal appointments? Almost exclusively, we want to carry out the root canal in one visit. It's very unusual these days to have to spread them out over 2. And what to eat after a root canal procedure? Basically, it's the same advice as the filling. If you could wait to eat until the anaesthetic is worn off, it's much safer for you. And why would somebody need a root canal treatment? Well, basically, you need a root canal treatment if your nerve has died, if you've developed an abscess, or you've got an inflamed nerve and it's a tooth that you want to keep. Those are the times you'd need a root canal in the back of the mouth. Sometimes if a person has an accident, trauma, sports, some sort of an injury, the impact from the trauma can strangle the nerve, and a front tooth might require a root canal because of that. And how would you know if your root canal is infected? Well, usually you'd have symptoms. It might be painful when you bite on it. It might be sensitive to hot and cold. Oftentimes you'll develop a swelling that'll tell you you've got an infection. Any of those circumstances, go to see the dentist. We'd be delighted to see you and see what the problem is. Telephone us in Dublin on 018786999 or visit our website, thefrederickdentalclinic.com, or send us an email at info@thefrederickdentalclinic.com. This is our main clinic, is on 33 North Frederick Street. It's just the top of O'Connell Street. Very easy to get to, serves all the north side of the city. Lewis stop's very, very close, so it's very centrally located, very, very easy to get to.